Assalamu alaikum. In this video, we are mainly concerned with Pheochromocytoma's morphology. But before starting its morphology, let me tell you people that what is Pheochromocytoma. Pheochromocytoma is actually a benign tumor as its name indicates. Here, Pheo means dark, chromo means color, and cyte means cell, and oma means tumor. As you know already, oma indicates any benign tumor, right? So pheochromocytoma here means dark colored cell tumor. As in this tumor, there are dark colored cells are present. Um, Moreover, this pheochromocytoma is a triad of palpitations, hypertension, and episodic sweating. You can remember this triad from a mnemonic as pheochromocytoma starts from three letters P, H, and E, palpitations, hypertension, and episodic sweating. And this is a tumor of neuroendocrine region. I will tell you two or three features of neuroendocrine tumor as well. That is not only peculiar or that is not only pathognomic for adrenal medulla, but also for any neuroendocrine tumor. So let us move towards its morphology. As you know that this is a tumor, that this tumor is of adrenal medulla. So here you can see that uh, this well circumscribed tumor is shown here. First of all, we are discussing about its gross morphology. So number one feature of gross morphology is that it is a well circumscribed tumor, as it is shown here that it is well circumscribed tumor. Number two, that areas of hemorrhage and necrosis can be seen, and as it is a very massive tumor, so its weight can also be up to several kilograms, right? And number two was areas of hemorrhage and necrosis. Number three was its weight, and number four is that it is growing so fast, or we can say that it is growing in such a manner that only a small portion of normal residual adrenal is left behind, which is here shown in coma shaped. You know what is a normal structure of adrenal gland? This is a normal structure of adrenal gland. Outside is adrenal cortex and inside is adrenal medulla. And as this is a tumor of adrenal medulla, so it is growing and growing and growing so much fast that only a comma shaped residual adrenal is left behind. Okay. So I will show you another picture of gross morphology of pheochromocytoma. Here you can also see that this is kidney, over it is adrenal gland, and it is adrenal medulla. And here somewhat areas of hemorrhage and necrosis are seen, and outside a normal, a little or a very normal, a very slight normal adrenal is left behind. And again, its color, another feature of gross morphology is that its color is actually yellow to tan color. Okay, you can see here that it is shown here it in yellow tan color, and here are some areas of hemorrhage and necrosis as well. Areas of hemorrhage and necrosis is actually not any peculiar pathognomic feature of any type of tumor, as it is common in all the tumors. So we cannot say that in this particular tumor areas of hemorrhage and necrosis will be seen, and in this tumor there are no areas of hemorrhage and necrosis. These areas will be present in all the types of tumors most often. Okay, so all this was about its gross morphology. I hope so that you must have understood what I am trying to convey to you people. Okay, so let's start about its microscopic features. One more feature is that when we take a cut section, for example, we take a cut section from here, and as it is yellow tan in color, but when we apply potassium dichromate to this tumor, but as we will apply potassium dichromate to this tumor will turn dark brown in color. And why this tumor will turn dark brown in color? Because of the oxidation of stored catecholamines. As I have you told before that this tumor contains mainly of chromatin cells, and chromatin cells normally produce catecholamines, and catecholamines are stored in this tumor. So when we stain it with potassium dichromate, oxidation of these catecholamines occur, and it will turn from yellow tan color to dark brown color. Now let us move towards its its microscopic features. In its microscopic features, you can see number one feature is that hair cells are arranged in the form of nests. Number one feature is that hair cells are arranged in the form of nests, and these nests are separated from each other by delicate fibrovascular network or simply vascular network. And this particular pattern is known as Zell-Bellin pattern. I am again repeating here that here nests are present, and these nests are separated by delicate fibrovascular stroma, and this particular pattern is known as Zell-Bellin pattern. And here the cells are more or less polygonal or spindle shaped. Again, you can see here that here nests of cells are present, and these nests of cells are actually separated by a fibrovascular stroma. Again, you can see here, you can take screenshot of this slide as well, that here it is well demarcated border, as I have shown you, as I have told you before, that it is a well circumscribed tumor. Number two is that here cells are arranged in the form of nest. Number three is that here sustenticular cells as well as chromatin cells are present, and these nests are separated by delicate fibrovascular stroma. I hope so that all this will be clear to you people. Again, now I will tell you that what is the neuroendocrine features. What are the features of a neuroendocrine tumor that is also common in this pheochromocytoma? You can see here that let me zoom it out. You can see here that here salt and pepper chromatin is present. I have told the about the salt and pepper chromatin in my previous video. It is actually the speckled or stippled appearance of the chromatin. Some in some areas there is prominent chromatin, in some areas there is empty chromatin, so it gives rise to stippled chromatin, which is known as salt and pepper chromatin. You must be have seen in your homes salt and pepper. Okay, so just give me some time. I will show you salt and pepper pattern in this video as well. And I hope so that this was all about pheochromocytoma. Rule of 10, you must know about the rule of 10 in pheochromocytomas, that 10% of the pheochromocytomas are extraadrenal, 10% are bilateral, 10% are malignant, and 10% are associated with hypertension. But as I'm not concerned with its pathogenesis or its other features in this video, so I'm not explaining it, but I am telling here so that you must remember or you must know about the pheochromocytoma. Okay, so one more feature is that pheochromocytoma can do both capsular invasion as well as vascular invasion. Okay, so in the case of pheochromocytoma, if you want to see that either it has been associated with malignancy or not, you have to see its metastasis. Okay, after seeing the metastasis in distant sites or in the regional lymph nodes in distant sites like LLB, LLB means liver, lung, and bone. It is just a mnemonic. There is nothing like LLB. So after seeing these three sites that either here metastases have occurred or not, you can tell that either this tumor has become malignant or not. Again, this is a picture of your big robins. Here you can see salt and pepper chromatin. Here you can see salt and pepper chromatin. It has also been written zelbellin. I have explained it before. And then electron microscopy. In electron microscopy of this tumor, such type of granules, membrane bound secretory granules, can be seen easily. Here, this is actually salt and pepper chromatin. You can see here salt and pepper, and here you can see that on staining we can see salt and pepper chromatin, and it is not a pathognomic feature for only the pheochromocytoma. It is common in all the neuroendocrine tumors like medullary carcinoma of the thyroid, like carcinoid tumors, etc. Like here, another picture of salt and pepper chromatin. So that was all about pheochromocytoma. I hope so that it will be clear to you people. Thank you very much.